Have you ever wondered what the difference between acid reflux, heartburn, and indigestion is? Hi, my name's Luke and I'm the lead dietitian here at Active Health Clinic. And today I wanted to take you through the same but different nature of these feelings that are quite common in a lot of people, but especially in our population. And what the impact of each of these things might be on the way that you eat, and also what to do if you experience them on a regular basis. So first things first, acid reflux or just reflux is the most common thing that people in our population might present with of these three conditions. And what it is, in essence, is just that rising of stomach acid from your stomach into your esophagus and then into the top of your throat or into your mouth. Now, that might be something you actually know is happening at the time. You might feel like you need to keep swallowing that stomach acid, or you might only realize it when it actually comes into your mouth and you get that really metallic-y taste or metallic-y smell to your breath. Now, some people might not even notice it at all, and that's what we call silent reflux. The second thing is heartburn, and that's more the general feeling of that acid rising and really burning in the bottom of your esophagus here. And you might feel it most commonly in the bottom of your rib cage here, but it could also extend across the diaphragm and into your lower back. Now, indigestion is really more just that feeling of heaviness in your stomach after you've eaten a large meal, and that sort of like post-Christmas meal slump on the couch where you just feel that heaviness. And a lot of people might describe this interchangeably with bloating or distension, or they might be two very separate things for people, but they might feel them at the same time. Now, each of these are going to make it difficult to eat more food in the next few hours, obviously. When we have that acid reflux, that doesn't really just go away in 30 minutes and then we can sort of eat again. So that's something that we might want to consider having some medication for, which you can speak to your doctor about, or coming and seeing a dietitian about, if you feel that a lot of it is actually food-based, as in you eat a certain food and then you get that reflux. Now, this heartburn that we talk of, obviously that's more of a sign of that reflux. So that might be an associated thing that we need to go and see a doctor or a dietitian about. But this indigestion, oftentimes that's actually just a result of overeating to your stomach capacity over any particular meal. And that might be something that we need to learn a little bit more about, what sort of portion that you need in a meal to be able to prevent. Now, that's something you might be able to do yourself, but if you're someone who has trouble noticing your appetite signals and actually stopping when you feel full, that might be something you might want to come and see a dietitian about too. So there's an example of how those three feelings or explanations are different and what you might need to do if you feel any of them on a regular basis. Now, I hope this video has been helpful. If you have any further questions, please feel free to drop a comment below or reach out to us and we'd be more than happy to help you. As usual, take care and happy eating.